We're also waiting on the governor of New York, Kathy Hochul. She is signing this sweeping disaster emergency order that is going to give her broad powers over how she is able, as the governor of New York State, to respond to this latest variant and the spread of it, potentially. It's not that she's implementing these decisions, but she wants to be allowed to make those decisions. It allows the state government to delay non-essential surgeries. We remember that from the beginning of the pandemic when Governor Cuomo was in power, and also get the state involved if she feels that local governments are not up to the task. So we're waiting to hear from her. Fox News medical contributor Dr. Janette Nesheiwat is with us now. Dr. Nesheiwat, so a lot to dig into here first. But first to this idea that as this new variant possibly spreads, there's reports that it's already, Dr. Sapphire was joining us last hour, Dr. Fauci, they believe that that variant is already in this country. There's reported cases in Canada as well. Assuming that that is the case and that this does further spread, Governor Hochul, does she have a point in declaring this emergency so that she can have vast powers if needed?
Well, Sandra, I understand the need to be prepared. I live and I work in New York. I'm seeing more cases, for example, of influenza A than I am of COVID right now. But I understand her wanting to be prepared because New York was once the epicenter of the world and it was chaotic at that time. What she's doing is if we drop below 10% of hospital bed capacity and staffing, then she wants to pause elective surgeries, for example. But right now, that's not the way to go. We don't want to pause, for example, skin biopsies and breast biopsies and colonoscopies, mammograms, you know, those sorts of things, those preventative measures that we need, because we're seeing an increase in the number of cancer rates and heart disease because a lot of people haven't been able to catch up with their preventative screening measures for their health.
Let me run by you then also the breaking news that we just brought to you top of the hour there out of Geneva. And that the World Health Organization is now saying that there's early evidence showing the global risk of this new variant is very high, and that future surges may have severe consequences, as President Biden tells the country not to panic.
Yes, correct. We should not panic. Again, we just need to prepare. How do we prepare? Get vaccinated. If you're eligible for a booster, if you're over the age of 18 and you're 6 months out, you need to get a booster. Having a booster skyrockets your protection, not just antibody protection, but B-cell and T-cell protection. So it doesn't matter if it's not specific, if the vaccine isn't specific for Omicron variant, it can still help you. So that's really important, taking those necessary common sense precautions. But I don't think we should panic. We know that the cases out of South Africa are breakthrough infections. They're mild. Some of the symptoms are the same: cough, headache, shortness of breath, wheezing, sometimes that can happen, a sore arm, fatigue, but they tend to be mild. We did not see an increase in the number of deaths and hospitalizations. Now, we have to also point out that the level of vaccination in South Africa is extremely low. Less than 30% are vaccinated. Here in the United States, we have almost 80% of Americans who have had at least one shot. So we're really in a better position. I think we just need to continue our mitigation safety measures that we've been doing for the past year and a half.
All right, two more quick questions on the Omicron variant and the fact that the drug companies, Pfizer and Moderna, as we just reported, are actively now preparing a new vaccine that would be able to fight off this new variant. Can you envision a scenario where so many of us who have had our booster shots, even now, 3 shots, where 3 months from now, if they have that ready, that we'll have to go out and get a 4th shot to protect from that?
Well, think of it, you know how with our flu shots, every year it's a different shot. It's slightly modified to make sure that we are covering the latest strains, the latest variants that are circulating. So it may be where we need to get that one-time specific booster variant shot for example, Omicron, but we're still kind of early in this entire process. It may be 3 shots a booster and then we're done for life, or 3 shots a booster and then it's yearly or every 10 years. But it's better to get that vaccine than to suffer the consequences of COVID.
Really quick question, because I'm out of time. But 5 to 12-year-olds, parents are right in with kids in those age gaps right now, in that age gap right now, are taking their kids, many of them out to get vaccinated, some not, but some are, and they have to make a decision. Do they wait now for the Omicron variant vaccine that they're working on to get their first or their second, or should they just get it now, real quick?
That's a great question. No, don't wait, because it can be 2 to 3 months before those new updated vaccines are available, and we're approaching Christmas, New Year's, the holidays, so get the vaccine now, protect yourself.
Always appreciate it. Dr. Nesheiwat, thanks so much.